Thank you so very much for sharing those comments with us. And I think Eric is going to speak now as a parent, but also a pediatrician who also had a similar experience.
Hello, and thank you again for inviting me. I stand at lecterns a lot to speak, but not about this topic, and it is only Rebecca who could get me to come up here and talk about my own family, but I will. So, little different story, and I am humbled by hearing what you had to say. So December 3rd, 1991, I was 6 months into my very first job as a pediatric oncologist. My wife was expecting our third child, and I had a great day at work that day. And on my way home, if you remember, we did not have cell phones then, or at least I didn't. And my wife kept paging me. Well, I'm on my way home. I wasn't going to get off the road and stop and find a payphone. So I got home and my wife said, we're at the pediatrician. And she was there because Alyssa had been very irritable for a couple of weeks and we couldn't figure out why, and now she had fevers. And anyway, so she said, you need to come over here right now because they think she has leukemia. So pretty unreal and long story, but I actually forgot how to get to the pediatrician's office. But anyway, so we went in and we started our treatment, and fortunately I was at an incredible place with people who were some of the world's experts on managing pediatric leukemia, and we were enrolled on a clinical trial, and we got through our first 3 years and did very well, past our 5-year mark, where I always say to parents, that's probably a cure. So then we come to, and actually she did very well through most of that time, but then we came to September 27th of 1997, and I had been away speaking at a meeting, and I came home and I was putting the kids to bed, and I saw all these bruises that I hadn't noticed before. Otherwise, she was fine, and I knew. So my wife we had just had our 4th child. So I just in the morning got up and said, I'm going to take Alyssa to work, and we stopped at this little community hospital, and I ordered a CBC, and I didn't tell anybody until the results came back, which showed that she had recurrence now 6 years after her initial diagnosis, which I tell people isn't supposed to happen. So, and just to put this into a little more perspective, during this interim time, I had been very involved in the pediatric oncology group in their leukemia relapse committee, and actually wrote the studies that had just ended for treating children with relapse leukemia. So we had no study open at that time. But anyway, again, with the help of those folks that we were involved with, we started treatment again. And oh, by the way, let me also say that at that time, the week before, I had accepted a new job moving to Florida, and we had just put our house on the market. So that's just where we were. So we went through our second treatment, and Alyssa was having a lot of issues in school. And we had her tested, and we had 504 plans, and we had IEP, which many of the parents certainly in the room know about. And despite all that, and the fact that I think I'm a pretty sophisticated consumer at this point, we could not get the services we needed in the school district, and in fact had to take Alyssa out of school and put her in a small private school because no matter what we did, we couldn't get the services that she needed. And so that was very hard, and we worked. When we got to high school, we were able to put her back in school, and she did fine. And she's done wonderfully all through college and master's degree, and we still have, I think, some significant issues, many of them which are things that I certainly didn't know about as an oncologist, as somebody who worked in relapse leukemia. And those issues that are very hard to understand are the social issues of being part of your peer group, because it's a little bit different. And at the time, nobody was writing anything about that. Right now, our biggest issue is in the area of unbelievable chronic fatigue. And I can't tell you how many times I've been told by people who have a lot of expertise, chronic fatigue is not part of survivorship from leukemia. nothing to do with it. Well, the very first study that actually looked at this and showed that there was some was from one of the Scandinavian countries, and it was just about 2 or 3 years ago. So people are seeing this now. And why didn't we see it? Well, the bottom line is, if as the oncologist you don't ask the patient, those are things that they don't think are related to their leukemia and may just think that's life and may not ask or tell you about them. And so very, very important as we go through this day, and you'll hear about some of the tools that have been created to really look at what are these issues and how can you help them. And I will close with the ultimate irony, which is right now, Alyssa is a special education teacher in the very school that we had to pull her out of in middle school because they would not meet her needs. So with that, I close.